Hi, Katie. I'm Gore,
And I'm Beverly Wang.
and we're going to be talking about Penicillin
Penicillin
G
G
aqueous.
aqueous.
I'll start us off in giving a little background about penicillin. Penicillin was one of the first antibiotics used to be effective against many infections caused by Staphylococcus and Streptococcus. Penicillin is a group of antibiotics including penicillin G, penicillin V, procaine penicillin, and benzathine penicillin. Among these, we're going to focus on penicillin G, and more specifically, penicillin G aqueous. The generic name is penicillin G aqueous with the trade name of Pfizer-Pen. Its mode of action is that penicillin interferes with the synthesis of the cell wall mucopeptide during active multiplications, resulting in bacterial activity against susceptible microorganisms. It has a half-life of 20 to 50 minutes. It's distributed among the blood-brain barrier using diffusion. Penicillin actually has a poor blood-brain barrier diffusion. It's excreted through the urine, has a peak plasma time of 30 minutes when IM or intramuscular, and has a peak plasma time of 1 hour if given through an IV. With this, we are leading into the route of administration. It's either given IV or IM, like I said before. If it is given IV, it's normally on a continuous drip of 500,000 to 5 million units per milliliter. And the usual dosage is 1 million units per 50 mils. And there are many types of infections that it can be used for, but mainly it's used for meningococcal meningitis. And when someone has this, they are given 20 to 30 million units per day, and they are put on an IV continuous drip. Also used for streptococcal infections like empyema, pneumonia, pericarditis, endocarditis, and meningitis. And when a patient has this, they will normally be given 5 to 24 million units per day. And it's 4 times per day. Also used for Lyme disease. They are given more units per day, 200,000 to 300,000 units per kilogram per day, and IV for normally 10 to 14 days. And Beverly will talk about some side effects, adverse effects, nursing implications, patient education, and pregnancy category.
Okay, so I'm going to start off with side effects, and there's a list of common and more serious side effects for penicillin G aqueous. So we'll start with the common side effects, and these are usually pain or redness or swelling at the injection site. You'll see some muscle or joint pain or even weakness too. Swelling of the ankles and feet are pretty common, and also looking at the urine is important. If it's darker colored or cloudy, that's a sign of a side effect you should let your doctor know. Extreme tiredness is common, irregular heartbeat, you might bruise easily, and you could also have kidney problems such as not producing enough urine or peeing too much. You could experience seizures, confusion, or numbness and tingling. So for the more serious side effects, we see C. diff associated symptoms such as chronic diarrhea, and that's something to definitely let your doctor know about. And we can even see oral thrush or a yeast infection if you use penicillin G aqueous for a long period of time. So moving on to the adverse effects, we often see anemia, low red blood count, interstitial nephritis, hypersensitivity, and sometimes even anaphylaxis. And also we would see Jerich's-Herxheimer reaction, which is associated with syphilis, and it's an antimicrobial treatment, which is rare, but it does happen sometimes. And then positive Combs reaction, which is when your antibodies act against your red blood cells, so it's an anemic reaction. And those are the list of adverse effects that you should really watch out for if you're on this medication. So now going to the nursing implications. If you are a nurse prescribing this medication or giving it, you should always observe the patient closely because they're at high risk for hypersensitivity. You want to notify the health provider immediately if your patient develops a skin rash, if they develop hives, if they have the chronic diarrhea that I mentioned before, any itching in the vaginal or anal area. They could develop furry tongue, sores in the mouth, and swelling around their eyes. And definitely want to reach out to a doctor if they have any shortness of breath or difficulty breathing. The GI tract is also disturbed with this medication sometimes. You can have nausea, vomiting, or diarrhea. So, moving on to the patient education when they go home, it's important to tell them a couple things to do before using this medication. So you want to check the product visually for particles, for discoloration, and if there are particles present and if the color isn't normal, you want to tell the patient not to intake the liquid. You want to give aminoglycoside, which is a bacterial antibiotic, separate from this type of penicillin because it doesn't mix together and it doesn't have a good reaction. And you want to use this med at the same time every day, so make sure to tell your patient to have a routine schedule and to always finish the complete prescribed dose, even if their symptoms subside early on. And lastly, for the pregnancy category, Penicillin G aqueous is in the category B, and that means that it may be acceptable, but it's not 100% approved. Human studies for this drug have shown that there's either no risk or harm in taking it, or there's not complete studies done. So it's in category B, and it's not very certain, but it's acceptable. And that is the end of our presentation.
Yes. We hope you learned a little bit more about Penicillin G aqueous.
Thank you.
Thank you.